Let's take a look at the structures on the skull. So from the anterior view here, we can see some of the cranial bones as well as some of the facial bones. So overlying the frontal lobe here is going to be the frontal bone. And then we have here where the teeth will insert into the alveolar margin, the maxilla. That is the upper jawbone. The lower jawbone is the mandible, and the teeth will insert via their gomphosis joints into the alveolar margin of the mandible. The cheekbones are called the zygomatic bones. These bones are bilateral. These two bones are the nasal bones. Here we can see a portion of the maxilla. The lacrimal bone, that's going to have a lacrimal fossa, which will provide a passageway for tears. And this is the ethmoid bone. And those bones help comprise the orbit. From a lateral view, we can see the parietal bone. This is the right parietal bone. This is a portion of the sphenoid bone. This is the temporal bone. And posteriorly here, we can see the occipital bone. Okay, now for some more minor structures on the skull. Superior to the orbit here, we see the supraorbital foraminae. Supraorbital foraminae. Inside the orbit, we have the optic canal. That's going to be the structure through which cranial nerve 2, the optic nerve, will traverse. And then we have the superior and inferior orbital fissures. So this is the superior, and this is the inferior orbital fissure. And both of those in tandem form a boomerang-like structure. Here we can see the nasal conchae, as well as the perpendicular plate and the vomer. This is the infraorbital foramen. This is another infraorbital foramen. On the body of the mandible here, we have the mental foraminae. This is a mental foramen. And this is a mental foramen. This is the angle of the mandible. And this is the ramus of the mandible. This is the coronoid process of the mandible. And this is the mandibular condyle, which will insert into the mandibular fossa at the temporal mandibular joint. Here we can see the external auditory meatus and the styloid process, as well as the mastoid process. Posteriorly here we can see the external occipital protuberance here, which will have an attachment to the trapezius muscle. Okay, the sutures. So these sutures, they're a type of joint, a sutural joint, and they are going to delineate the boundary between the cranial bones here. So this one is the lambdoid suture. That's going to be the boundary between the occipital bone and the two parietal bones. This is the sagittal suture. This is going to be the suture between the two parietal bones. And this is the coronal suture. That's going to be the boundary between the frontal bone and the parietal bone. All right, some more internal structures here. Take off the calvaria. And we can see the cranial fossae. So this is the anterior cranial fossa, this is the middle cranial fossa, and this is the posterior cranial fossa. Within the anterior cranial fossa, we can see the cribriform plate of the ethmoid bone here. And this is the crista galli, or a mohawk-like structure of bone that projects superiorly. And there are also olfactory foraminae through which the neural component of the olfactory system will traverse into the nasal cavity. This is the lesser wing of the sphenoid, and this is the greater wing of the sphenoid. This is the sella turcica, or the Turkish saddle, and this will be where the pituitary gland will sit. For the foraminae here, and other openings, we can see the foramen rotundum, the foramen ovale, the foramen lacerum, and the foramen spinosum. So that's Rawls. Rotundum, ovale, lacerum, and spinosum. And here we can see the optic canals where the optic nerve will traverse. In the posterior cranial fossa here, we can see the jugular foramen, the foramen magnum, and the hypoglossal canals. Okay, from an inferior view. Here we can see the palatine process of the maxilla and the incisive foramen between the two central incisors. This is the palatine bone. And here we can see the carotid canals. This is the stylomastoid foramen between the styloid process and the mastoid process. Those are bilateral, styloid process, stylomastoid foramen, and mastoid process. Foramen magnum again. These are the occipital condyles. This will be the structure upon which the two condyles of the C1 vertebra, the atlas, will articulate. And here we can see the foramen ovale, foramen ovale, foramen spinosum, foramen lacerum, and the jugular foramen. On the mandible, we can see the mandibular foramen. So this is going to be the site at which a dentist will insert anesthetic for a nerve block during a dental procedure. If we take off the mandible here, we can see the mandibular fossa. This is going to be where the condyles of the mandible will articulate, like so. Okay, those are the structures on the skull.